Good afternoon, folks. Now I'm going to set up for discussion C. So here we go. And it's discussing how crucial palliative care and end of life care is for somebody with a terminal illness. So please join me in today's presentation for palliative and end of life care discussion, please. Thanks. Palliative care and end of life care are essential services that focus on improving the quality of life for individuals with serious illnesses and families. Here is a brief overview. Okay, so we're going to go down through the presentation I did. So join me today for today's presentation, please. All right, palliative care. Purpose. Palliative care aims to provide relief from symptoms and stress of serious illnesses. Okay. Regardless of the diagnosis or stage of the disease, it focuses on improving quality of life for both the patient and their families. Okay, services, types of services that we can provide as end of life people. This type of care includes managing symptoms, providing emotional support and spiritual support, and coordinating care among different healthcare providers. Okay, so we become not just one person taking care of you, but a whole team. We collaborate with different other healthcare professionals to form a team for your care. So I'm going to discuss that now. Team. A palliative care team typically includes doctors, nurses, social workers, and other specialists who work together to support the patient and their family. So let me get the other sheets. Okay, now we're going to go into different settings that we can do this in. So I'm going to discuss that too. Palliative care can be provided in various settings, including hospitals, outpatient clinics, nursing homes, or at the person's home. Okay, then we go down to end of life care. Purpose. End of life care is a specific type of palliative care provided in the final weeks or months of life. It focuses on comfort and quality of life rather than curative treatments. Services for this one includes pain management, emotional support, emotional and spiritual support, and assistance with decision making and advanced care planning. Okay, then you go down to hospice, also that which I'm also certified in, so I'm going to discuss that for you. Hospice. Okay, hospice is a form of end of life care that provides comprehensive support to patients and their families during the final stages of a final or terminal illness. Okay. Both types of care are crucial in ensuring that the patient's with serious illnesses receive compassionate and, hold on, I'll get you the other sheet. Comprehensive supports tailored to their needs and preferences. So, just like I said in previous videos, we as end of life support care teams, we follow a care plan that the that the that that the client makes for themselves. We do what they request, and in a sense, and we give them support to live out their final days as pain-free as possible. That's all it is. That's all end of life care is, just to make sure somebody's not in pain when they pass. Or if they are in pain, make sure you have the right necessary medications or something to help them relieve the discomfort so they don't have to suffer. That's what it is. Okay. Then I'm going to go down to resources for you all, which this one comes from National Institute on Aging. The website is www.nih.gov/health/hospice and palliative care. And then it goes on to tell you the title of the article, which is what are palliative care and hospice care. This one discusses the difference between the two types of care that somebody needs. Like I said, you can personalize it with somebody's wishes, so they can go out in their pajamas or go out with music on their ears, go out with special colored sheets. Depends on what the person wants for end of life care. Depends how they set that up with hospice. With us as hospice people, depends on what they tell us. How they want things. I've seen people have strawberry daiquiris at the end of life, and cheeseburgers, Cokes. I've seen people go out with lotion on their feet. I've seen people go out with nightgowns, specific blankets, specific sheets, colored sheets, because they don't like institutional light, so colored sheets. Depends on how a person wants to set up the place where they're going to be spending the rest of their day. Be it a room, a couch. Depends where they want to be. Everybody's typical place would be their own home. That's the perfect place to be. If you're in your own home, it's more relaxed. But if you can't be, then our job as end of life people is to help you create comfort in the space that you're in. Make it not so clinical. So you can personalize somebody's passing how they want. And then at their celebration of life, some people don't want funerals. Some people want dances. I've seen people where people want hoedowns instead of traditional funerals. That happens also. Just depends on how a person wants to handle that situation, handle their disease, handle their illness. It depends on how they want to do it. You're just the facilitator. You know, people like myself, we're just here to support people. You know, that's my job. You know, that's the whole end of life deal. That is so you can help somebody pass with peace. Give them what they want, right down to the T, exactly how they want it. If you have to if you have to bend some rules, if you can bend the rules, if the facility will let you bend some rules, do so for them. If it's small, if you can do it for them and it's a small thing, go ahead and do it, because they're going to be passing anyway. So if their last request is small and you can handle the last request they have, go ahead and set it up for them so they can pass with peace. You don't want to see a person pass with a distress because they fight with it. That's the worst thing you can see somebody do, is fight with it. You want to see them with a smile on their face. They want to know that you as a person, you really care. You know, you want to make it feel like you really care. Like when I do somebody's care, I do care about it right down to the end. That's what you're supposed to do as an end of life specialist. Thought I'd do a show on that today for everybody's information. Hope this helps somebody with this situation. Like I've said in other videos, if anybody has any questions, comments, things they want me to look into, leave it in the chat below for me, please, and I'll see what I can do about getting it on for you. For now, greater wellness. Take care, folks.